Every morning, millions of people do something they believe is completely healthy. They pour a glass of grapefruit juice, take their morning medication, and start their day. Here's a number I want you to remember: 85. That's the number of medications, 85, that the U.S. Food and Drug Administration has identified as having a documented interaction with grapefruit. Not a mild interaction. In some cases, an interaction serious enough to send someone to the emergency room. And the medications on that list aren't obscure. They're some of the most commonly prescribed drugs in the world. Blood pressure medications like Amlodipine, heart rhythm medications like Metoprolol, and blood thinners like Warfarin. Why this matters right now. This isn't a fringe concern buried in a pharmacy pamphlet nobody reads. The interaction between grapefruit and certain medications is one of the most well-documented drug-food interactions in modern pharmacology, studied for over 3 decades since it was first discovered almost by accident in a Canadian research lab in the early 1990s. And yet, survey data consistently shows that a majority of patients taking an affected medication have never been warned about it in a way they actually remembered. Not because their doctor didn't care, but because a 15-minute appointment covering diagnosis, dosage, side effects, and follow-up rarely leaves room for a conversation about fruit. Here's why that gap matters so much for people over 60. This is also the age group most likely to be on one or more of these interacting medications long-term, often without ever revisiting the original conversation about what to avoid. If you or someone you love takes any of these, what you're about to learn could change how you think about breakfast. Stay with me until the end because the third medication on this list is one almost nobody realizes is affected, and the mistake people make with it is quietly, dangerously common. What's actually happening? The mechanism. Let's break down exactly what's going on because once you understand the mechanism, you'll never look at a grapefruit the same way again. Your gut and liver contain an enzyme called CYP3A4. Think of this enzyme as a kind of processing plant. When you swallow a pill, CYP3A4 is one of the main systems responsible for breaking that medication down before it fully enters your bloodstream, controlling how much of the drug actually reaches active circulation. Grapefruit contains natural compounds called furanocoumarins. These compounds do something unusual. They block CYP3A4, sometimes for up to 24 hours after a single glass of juice. When that enzyme is blocked, your body can no longer break the medication down at its normal rate. The result is that a much larger percentage of the drug than intended ends up in your bloodstream, sometimes 2, 3, even several times the expected concentration, depending on the medication. This is not the same as an allergic reaction, and it's not about grapefruit being unhealthy. Grapefruit itself is nutritious. The problem is purely mechanical. It's an enzyme interaction, and it happens whether you eat the fruit, drink the juice, or even take certain grapefruit-containing supplements. The research behind it. This interaction was first documented in 1991 when researchers studying an unrelated blood pressure medication used grapefruit juice to mask the taste of alcohol in a control group and stumbled onto unexpectedly high drug levels in participants' blood. What started as an accidental discovery became one of the most studied drug-food interactions in pharmacology. Since then, research published in journals including the Canadian Medical Association Journal and reviews compiled by the US FDA have confirmed and expanded the list of affected medications, now covering blood pressure drugs, statins, certain blood thinners, immunosuppressants, and some anti-anxiety medications. The FDA's own consumer guidance is direct. For medications known to interact with grapefruit, even small, consistent amounts, not just large quantities, can meaningfully affect drug levels in the blood. This is why the standard medical advice for many affected drugs isn't limit grapefruit, it's avoided entirely for the duration of treatment. Why this slips through the cracks? If the research is this well established, why do so many people still not know? A few honest reasons. It's a food interaction, not a drug interaction. Pharmacy systems are built to flag drug-to-drug conflicts automatically. Food interactions often depend on the patient remembering a verbal warning, one conversation, once, years ago. Grapefruit feels healthy, Nobody thinks twice about fruit the way they think twice about alcohol or another medication. That's exactly what makes this interaction so easy to miss. The effect is invisible day to day. You won't necessarily feel different after one glass. The danger builds through altered drug concentration, not through an immediate obvious symptom, which makes it easy to keep the habit going for years without consequence, until the day it isn't. If you're finding this kind of evidence-based, practical health information useful, this channel publishes a new video like this every week. No supplements, no hype, just research translated into something you can actually use. Consider subscribing so you don't miss the next one. Medication 1. Amlodipine. Amlodipine is one of the most widely prescribed blood pressure medications in the world, commonly used to manage hypertension in adults over 60. Amlodipine is broken down by CYP3A4. When grapefruit blocks that enzyme, blood levels of amlodipine can rise significantly above the intended dose. Because amlodipine works by relaxing blood vessels, an unintentionally elevated level can cause blood pressure to drop further than expected, leading to dizziness, lightheadedness, and in some documented cases, fainting, particularly in older adults already prone to blood pressure fluctuations. Mechanism: CYP3A4 inhibition leads to elevated amlodipine concentration. Documented concern: exaggerated blood pressure lowering effect, increased fall risk in seniors. What to do instead? If you take amlodipine, this is a conversation worth having directly with your prescribing doctor or pharmacist. They can tell you whether your specific formulation and dose are affected, and what a safe alternative citrus or juice option looks like for your morning routine. Medication 2. Metoprolol. Metoprolol is a beta blocker, commonly prescribed for high blood pressure, irregular heart rhythms, and after certain cardiac events to help control heart rate. Unlike amlodipine, metoprolol's interaction with grapefruit is less about CYP3A4 and more about a different absorption pathway. But the outcome researchers have documented is similarly concerning: altered blood concentration of the medication, which can affect how consistently your heart rate and rhythm are controlled. For someone managing a heart condition, consistency is the entire point of the medication. An unpredictable rise or fall in drug levels, even occasionally, undermines the steady control that beta blockers like metoprolol are specifically prescribed to provide. Mechanism: altered drug absorption and metabolism pathway. Documented concern: inconsistent heart rate control, unpredictable medication levels. What to do instead? Because beta blocker interactions can vary significantly by the specific drug in this class, this is one of the clearest cases where checking with a pharmacist, who can look up your exact medication, is far safer than guessing based on general information. Medication 3. Warfarin, the one most people miss. This is the one I promised you at the start, because unlike amlodipine and metoprolol, most people taking warfarin have never been told to think twice about grapefruit, largely because warfarin's primary well-known food interaction is with vitamin K, not citrus. That singular focus on vitamin K has, ironically, caused the grapefruit warning to get lost entirely. Warfarin is a blood thinner, prescribed to reduce the risk of dangerous blood clots, often in patients with atrial fibrillation, a history of stroke, or after certain surgeries. It works within an extremely narrow therapeutic window. Too little, and clots can form. Too much, and the risk of dangerous internal bleeding rises sharply. Research has found that grapefruit can affect the metabolism of warfarin in some patients, potentially shifting blood levels of the medication outside that narrow, safe window. Because warfarin's effect is already closely monitored through regular blood tests, measuring what's called your INR, or International Normalized Ratio, any outside factor that shifts your levels between tests can throw off the delicate balance your doctor is working to maintain. Mechanism: altered warfarin metabolism affecting the therapeutic window. Documented concern: unpredictable INR fluctuation, increased bleeding or clotting risk. This is precisely the mistake so many seniors make. They carefully track their vitamin K intake because they were told to, while continuing to drink grapefruit juice every morning, never realizing it belongs in the same conversation. What to do instead? If you're on Warfarin, mention grapefruit specifically at your next INR check. Don't assume it's already been covered just because you've discussed diet before. What to do with this information? To be clear, this doesn't mean grapefruit is dangerous for everyone or that it needs to be feared. Most medications have no interaction with it at all. The issue is specific to a defined list of drugs, and if you're not on one of them, none of this changes anything about your morning routine. But if you take amlodipine, metoprolol, warfarin, or honestly any regular medication, here's the simple, practical step. The next time you pick up a prescription, ask your pharmacist one direct question. Does this medication interact with grapefruit? Pharmacists have this information instantly available, and it takes them seconds to check. If you're already an occasional grapefruit consumer and you're on one of these medications, don't make any changes on your own. Bring it up with your doctor or pharmacist first, since they can advise based on your specific dose and health history. Recap. Let's bring it together. Grapefruit contains furanocoumarins, which block the CYP3A4 enzyme responsible for breaking down many common medications. This can cause certain drugs to build up in the bloodstream at higher than intended levels. Amlodipine, risk of exaggerated blood pressure lowering effect and dizziness. Metoprolol, risk of inconsistent heart rate control. Warfarin, risk of unpredictable INR fluctuation, affecting clotting and bleeding balance. The one interaction most patients have never been warned about. The fix isn't fear, it's one simple question to your pharmacist. This is exactly the kind of small, easily missed detail that a 5-minute conversation can resolve, but only if you know to ask.